question if you wanted to ask while we are working over there in the third world country, in the developing country.
Are these children also under medical care? Are they on medications if needed?
Yeah, this is a good question. And they are on the medications because
good.
they are having lack of sleep and then food problems. So they are on the medications. And they have got certain health problems, as these children with special needs have. So the autistic children they are on the medications. But you know, the many children, even if they are underprivileged, they could not even afford the health that, you know, like sort of medicines and everything. They don't go to the psychiatrist, and they are treating themselves at homes. But when they are coming to the institutions, to like our institution, we do guide them and show the child to the psychiatrist, show the child to the because we are having the psychologist at the center, but to the pediatrician as well.
Yes.
So they should be under the umbrella of the pediatrician, the psychiatrist. But we always do try and send them to the required people over there.
Okay, that's great.
At times, and at times we could not.
Yes.
You know, we have, and as you are saying, the resources, when we talk about the resources, what do you think? Do you have all the resources over here in the West? Because that's a complete health system, insurance system.
Yes. I mean, obviously, in a clinic like this, an outpatient clinic, our psychiatrist can refer, like if there's a child who they feel is having medical problems, they will refer that child to another professional.
Yeah.
There are tons, well, maybe not tons, but a lot of special programs for some of these kids where they go to like a school setting or something. It's kind of like
school setting.
Yeah.
As we are doing over there, it's like our center is like a Montessori for these children with special needs, and they are having one-on-one sessions there, and then a group sessions as well.
Yeah, that's great.
Like the music therapy, lunch therapy, each and everything. So it's like the setup of the school. So it's a good thing to hear that they have been doing over here as also a setup of like a school. It's not a proper school, but it's a setup of like a school.
Yes.
So this is a good thing.
I know that we have a university, Eastern Michigan University.
Okay.
And I think it's through their psychology program. They actually have a program where they have some of the higher functioning autism come in and learn a lot of the social skills.
Social skills.
Among themselves with other people, and how to do things properly, like make a phone call, or what do I say when this happens, or things like that. A little more higher functioning kinds of things, but that program is great.
Great. So as you talked about this daily living skill, which we call executive functional skills, which are very important, and I have seen and I have come across children or some adults with autism as well. So they are good at so many things, at their proficiency in the languages, and then their what could I say, IT, and but they are lacking their daily living skills.
Yes.
So what's the reason for that? That they are good, they are high functioning, but they are lacking in daily living skills. They could not dress themselves. They could not, dye their hair. They could not do the other daily living skills. So what's the reason for that? So are they not trained in that way, the daily living skills, or what's the reason behind that?
To make them more independent and function more comfortably.
Yeah, it's important.
In wherever they are. I have one probably 15, 16-year-old high-functioning autism client, and he is extremely bright. He is getting straight A's in school.
Wow.
He also, interestingly, he stands up for what's right. So when other kids in the classroom are being rude to the teacher, he will stand up and say, "Excuse me, you're being rude to the teacher."
So he understands all
the behaviors. So he has some really good skills.
Good skills.
But yet he doesn't have as many social skills one-on-one. He doesn't make friends as easily.
Yeah.
But he is really high functioning in some areas.
And in some areas, strengths and some areas. दर्द दिल के वास्ते पैदा किया इंसान को,
वरना अतात के लिए कुछ कम न थे करो बयां।